Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Just to give you a sense for incidence of colon cancer, so the most common form of cancer in men is prostate cancer, and women it's breast cancer. But when you combine the two together, lung cancer is the most common form of cancer and colorectal cancer is the second. And most cases occur after age 50. But we also know that there's been an increased incidence of colorectal cancer in patients under age 50.
What is the most effective way to prevent colon cancer?
By far the most effective way to prevent colon cancer is through screening. And a screening colonoscopy is really the gold standard in 2015 for evaluation of the colon for these precancerous polyps.
Why is it important to screen for colon cancer?
Most early polyps or early cancers don't show any symptoms. So that's why patients say, well, I feel well, I don't need to come in for any type of a testing. And so that's why we call it a screening examination. It's an exam that's done for somebody when they're not having any symptoms.
Who should be screened for colon cancer?
Patients who are over age 50. The second group are patients who have a family history of colorectal cancers.
What can one expect when getting screened for colon cancer?
You do have to drink a bowel prep, which basically purges the colon and clears you out so that when you pass the scope through, you have a good view of the inside lining of the colon. When you come in for the examination that day, we typically give patients sedation, and ultimately what happens is you come into the room, you fall asleep, and you wake up and the examination is done.
Is colon cancer treatable when detected through screening?
If we find them in an early stage, typically we'll take patients to the operating room and do a bowel resection. This is an operation we do laparoscopically, but when patients come in with early forms of colon cancer or rectal cancer, it's very curable.